AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. January is Cervical Cancer Awareness Month, and so to discuss that topic as well as the HPV vaccine is Dr. Heather Williams. And Dr. Williams, you are the, I want to get this right, gynecological oncologist at UAMS. Did I get it right? Okay. Well, thank you for joining us today.
I am glad to be here.
So let's first kind of level set and talk about just what is cervical cancer.
So cervical cancer is cancer that starts in the cervix, and it can either start on the kind of the cells on the outside of the cervix or inside the kind of opening of the cervix.
Now, is cervical cancer something completely different than HPV?
It is. HPV causes cervical cancer. HPV is a viral infection, and it stands for human papilloma virus.
Okay. Now, if you were diagnosed with HPV, does that mean you will develop cervical cancer, or does that mean you have a higher risk of developing?
That's correct. You have a higher risk for getting cancer if you have an infection with HPV. And there are different types of strains of the virus, which we all learned from the pandemic, different strains. Yep. And so there's really two strains of the HPV virus that cause 99% of cervical cancers. And that is HPV 16 and 18. And so pap smears are the screening tool that helps screen for the HPV infection and then also screen for any abnormal cells. The goal of the pap smear is to catch the infection when it just begins or when it's early, and it can be treated so that it doesn't have the opportunity to develop into cancer.
I want to talk to you about risk factors, but before we do, if the pap is what is used for screening, and a female has consistently had normal results on her pap, is she out of the woods or not necessarily? Could this rear its ugly head many, many years down the road? Or do we know?
So it's a great question. Sometimes we do get patients many years after the fact that kind of end up with an infection. And so we do think that maybe the virus can lay what's called dormant, similar to how people get shingles later in life.
Sure.
So there is some thought to that. Certainly, if you are someone that was in a relationship early on and then have a new partner, a new spouse, there's the potential there to come in contact with a new infection that you didn't have before. And then that is a way that you could also come up with it. Okay.
Well, let's go back to some other risk factors, because there are, I'm sure, a whole slew of them.
Sure. So smoking is a big risk factor for this. It just alters your body's ability to fight the infection off. And then anyone who has chronic immunosuppression, so maybe you take drugs for, say, rheumatoid arthritis or some other autoimmune condition, you're at increased risk for not being able to kind of clear this infection. And then sexual activity, it is a sexually transmitted virus, but it is very common, and up to 80 to 90% of people will have been exposed by the time they're in their 40s or 50s. And so if you, say, are someone who had kind of earlier onset of sexual activity, or you are with a partner who has a history of having multiple partners, that increases your chance just to be exposed to the virus.
Sure.
And then I'm trying to think of, those are really the big ones.
Are there any signs that we as women should be aware of if we start to recognize that something may seem abnormal?
Yes. So some of the symptoms can be very subtle, and women are constantly taking care of other people, so they tend to just brush things off.
That's right.
But really, sort of the big ones, if you start having any discharge that can be watery, or maybe seems like there might be an infection that doesn't clear, I encourage you to see your doctor, not just get antibiotics, kind of prescribed over the phone. We're busy, so sometimes that's done. But if it doesn't clear up, I do encourage you to be seen. If you have any bleeding after sexual activity, that can be a sign. If you're having bleeding in between your periods, that can be something that can be a sign of this. And then just other kind of pelvic pain, feeling of like pressure or heaviness in the pelvis, changes in how you're emptying your bladder. So maybe you're going to the bathroom more often, not feeling like you're emptying your bladder. Those are all kind of non-specific things that could be a sign.
Okay. How early can cervical cancer show up? Is there an age?
Yeah. So it can show up, as early as someone kind of gets exposed and gets the infection. The vast majority of cases, though, it does follow kind of a progression. So there's a period of infection, and that infection has to kind of change the cells in that environment, and then those cells kind of become abnormal, and then over time, they develop the ability to, they become so abnormal that they become cancer. So it's not like it happens overnight. On average, we say, from exposure to cancer is approximately like a 10-year timeline. Okay. But it can happen much earlier. But we do recommend that women start having pap smears by the age of 21. And so the assumption there is that, if they became sexually active in their teen years and they were exposed, at that point their body should have cleared the virus. But if it hasn't, then it would be picked up on the pap smear, and then they can get the appropriate treatment or follow-up that they would need.
Gotcha. Okay. Is there treatment or even a cure once a positive diagnosis for cervical cancer is made?
Definitely, if the cancer is caught early, it is curable. Oftentimes, it can be cured with surgery if it's caught early enough. If it is too advanced for surgery and the patient needs chemotherapy with radiation, that too can be curative in a lot of patients. Really the key is just being aware and early diagnosis. Once it is advanced, and so stage 3 or 4, it does become more difficult to cure in those settings, and oftentimes the treatment, the intent is to kind of make sure the patient is not symptomatic from it, and then also to help slow the progression of the disease.
Okay. Can this be fatal? For
cervical cancer, cervical cancer definitely can be fatal. Yeah. And we still lose about 5,000 to 6,000 women in the United States each year to cervical cancer.
Okay. But we don't have to get to that point.
No, we don't.
Yes, that's the good news here. What else? What else would you like to add?
So I think a big component when we talk about cervical cancer, like you said, we don't have to get to that point. So actually, this, like I said, 99% of cases are caused by a virus, and we actually have a vaccination that is protective against the virus, the HPV vaccine, and it can be given to boys and girls starting at age 11, and it is recommended up to even age 45 for certain patients. And this will prevent the 2 strains that cause the majority of cervical cancer. It also helps prevent genital warts, which is another discussion, but that can be very disfiguring and life-altering for patients that suffer with that. Sure. So really we have an opportunity to really eradicate cervical cancer. And other countries that have kind of implemented widespread vaccination are on target to eliminate cervical cancer from detectable levels, essentially, which would be wonderful. Cervical cancer it is an orphan disease. It takes our mothers and our sisters. It can also take our grandmothers, but it definitely leaves children without their mothers. And so we really need to make sure that you get the word out about the vaccine. It is safe, so I do encourage you to speak with your doctor or your child's pediatrician about it, because it is safe. And again, it's a cancer-fighting vaccine. And if we can prevent it, then that's the best cure for sure.
For sure. In our remaining moments, just touch on the importance of having conversations with your doctor, your OBGYN, and just how important having those open conversations really are.
Well, extremely important.
Yes.
You know, oftentimes the patients are the best advocates for themselves. And if the patient feels like something is wrong or you're having a symptom, you know, and you don't feel like you're being heard, I encourage you to kind of speak up and really be an advocate for yourself to get the care you need, but also ask questions. Again, though, screening with your pap smear is very important, and typically, on average, that's going to be every 3 years. I do recommend women follow up with their whoever is doing their well woman exam, so that they can at least have a pelvic exam every 1 to 2 years to make sure that nothing has kind of developed since their last pap smear. A lot of women we see with cervical cancer, they give the same history that they haven't been back to their OBGYN since they had their baby, because women are generally more healthy and they don't feel the need, and they probably don't have the time, but it is very important for them to take care of themselves and to continue to get their pap smear screenings.
Okay. If someone wanted to reach out to you, how would they do that? Do we direct them to UAMS's website?
Yes.
Okay.
Yes, that would be a perfect way.
Fantastic. All right. Dr. Williams, anything else you'd like to add for Cervical Cancer Awareness Month?
I think we've covered everything today.
Fantastic. Okay. Well, thank you so much for coming in and joining us today.
Thank you.
And thank you so much for joining us. We'll see you back here next week for more AFMC TV.